It is coming up now on 7:05. Bernadette Lee, Ian Auzenne with you on Acadiana's Morning News. And a lot of discussion going on about the rising number of cases with COVID and what we're seeing versus what things were like before and a continuation. So, as we have done in the past, joining us on the line this morning, the Chief Medical Officer with Our Lady of Lourdes, Dr. Henry Kaufman. Sir, good morning. Thanks for joining us.
Good morning, Bernie. You're very welcome.
As we look at what we are dealing with COVID this time, what is the Delta variant really like, and what are you guys experiencing right now?
So the Delta variant is an evolution of the COVID-19 virus. All viruses, as living organisms evolve, and when they're going through millions and trillions of replications, as this one is, they're going to evolve in a more efficient form. And that's exactly what this one has done. And so what we're seeing is that it's more transmissible. It's maybe as many as 2 to 2.5 times more transmissible than the first COVID variant. And unfortunately, unlike other viruses in previous pandemics, this one didn't do what we call attenuate, which has become less virulent, less damaging, less infectious. It's actually become more infectious, and it's resulting in more severe illness and prolonged hospitalizations, even more than the first one did. So the virus itself is mutating and heading in a direction that's not good for us. What we're experiencing locally is similar to what other areas with low vaccination across the country are seeing, is that we're having a dramatic upsurge in cases. Within the last 4 to 5 weeks, we've seen our COVID numbers in the hospital quadruple. So we've gone to about 5 to 7% of the hospital capacity being filled with COVID patients, to today it's right around 25% of the hospital capacity. Back during our biggest surge, our biggest peak, we were at just over 50% of hospital capacity was involved with COVID, and that had a very serious effect on operations that, we're still seeing the repercussions of it now from other people not being able to access the hospital and having deferred or delayed care.
So what about younger people? You were speaking, of course, the Delta variant of this virus does seem to be obviously much more serious. For younger people, is it different for them too? And I'm talking about folks that are maybe in their 20s and 30s, and what are the differences this go around?
Well, it's been very different from what we're seeing in the hospital. During the first waves, we were really seeing the elderly, the people with significant risk factors, obesity, diabetes, immunocompromised states, emphysema, things like that. I think that we've done a really good job of vaccinating those people, and those people have a better sense of their risk and their mortality. Yeah. And so instead of the majority, maybe 50% of the patients in the hospital being over that 65-year-old age group, we're now seeing the inverse. And the majority of the patients that we're seeing in the hospital right now are in the 18 to 55-year-old age group, and maybe even more so kind of 35 to 55-year-olds are the ones who are in there in the ICUs, on the ventilator, sick, occasionally dying from COVID. And so it's been a complete switch in the demographics of who we're seeing in the hospital.
So there are, I think 30% of us is the rough estimate of the people in Louisiana who are vaccinated. For me, it was an easy choice because I have a whole list of medical issues. So for somebody like me who's already got the vaccine, if I do encounter the Delta variant and I do become infected and sick with it, I know you don't have a crystal ball, Dr. Kaufman, but what does it mean for me in terms of my illness perhaps and hospitalization? Are my chances better that it'll be a little bit easier on me?
Your chances are much better.
Okay.
We use statistical modeling and population numbers to make predictions. Trying to define those to one individual like you is very difficult.
Right.
I can't say for you, Bernie, you're going to be perfectly fine. But what I can say is, looking at large numbers of people, millions of people, there's a 96% chance that the vaccine is going to protect you from a hospitalization. Mm-hmm. And there's about an 85% chance that it's going to protect you from a serious illness. So, yes, you can still get COVID, but it's much likely going to be a much milder event. It's going to be much less likely that you're going to have long-term repercussions of having COVID, and much, much less likely that you're going to be hospitalized or require ICU care.
You gave a lot of good numbers there. But for some people, they'll say, we're not taking it because it's not 100% effective. We're not going to take it because it's not FDA approved.
Yeah.
We're not going to do this because of this or that. For the naysayers who don't want to take the vaccine because it's not 100% effective, because it doesn't have full FDA authorization, whatever the case may be, what do you say to those people?
So modern medicine is all about shaving risks off everywhere you can. I do a remarkable checklist of things for people before surgical procedures, because anything that even has sometimes a fraction of a percentage of an improvement has a real meaningful impact when you're looking at the number of people that, we care for. There are a few treatments in medicine that are 96% effective. Mm-hmm. If I had a pill that I could give everybody or an injection that would prevent 96% of cancer, it would have just a remarkable dramatic impact on healthcare and the dollars spent and lives saved and people living longer and living better. It's not 100% effective, but it's highly effective. And I think it's fair to say that in our current state, with our relatively low number of vaccinated individuals, that there are two inevitabilities here. One, you're going to get vaccinated, and you're very likely going to be fine and get through this, and it's going to be a very minor event in your life if you even get infected. Or two, you're going to inevitably become infected with COVID, and it will be probably the most serious viral illness you will ever have over the course of your life. And there's a good chance that you're going to have long-term effects, and there's a fair chance that you're going to be hospitalized, and there's a small chance that you're going to have significant long-term repercussions and or death. So, looking at the models and the numbers moving forward, when you're in a community where the vaccination rates are low, it's an inevitability that you're either going to get vaccinated or you're going to get COVID, or you have to live as a hermit. And I don't think most people are willing to do that.
Yes, that's certainly true. If you're just joining us, Dr. Henry Kaufman, who's the Chief Medical Officer of Our Lady of Lourdes, is joining us. Ian, I know you have some other questions.
I want to go back to the efficacy part of this with the COVID vaccine. We have a ton of other vaccines that we're all familiar with and vaccines we've taken. The polio vaccine, MMR, tetanus shots, flu shot. The list goes on and on. Compared to other vaccines and other preventative shots, how does the COVID shot compare in terms of efficacy with those others?
Very comparable. In fact, a lot of those vaccines aren't nearly as effective as COVID is, as the COVID vaccines have been. But when you get enough, even if it's, let's just say a vaccine's 70% effective, if you have 99% of the population is immunized with something that's 70% effective, there's enough immunity in the population that even if one individual gets it, it can't spread. And so that's how we've wiped out measles and smallpox and polio and these things which our grandparents, if you talk to your grandparents, ask them about, how they felt about these diseases when they were young and they were small. These were very real, compelling health issues that affected the last 2 to 3 generations that, we've now forgotten because it's not in our personal experience. It's historical, and we tend to forget those things and wash them in the past. But now we're having our infectious pandemic, and this is our generation's challenge. And the disconcerting thing, the disheartening thing, is that because of advances in modern science, we now have in very short order this incredibly effective treatment that can nearly wipe out this virus in our communities, and yet we're not accessing it because of fear and misinformation.
So let me make sure I understand you right. The herd immunity that we've heard so much about since the beginning of this pandemic, that herd immunity can only be achieved through vaccination. Is that what you're telling us?
Well, it can be achieved through vaccination or it can be achieved through infection. The problem is if it's achieved through infection, we're not only going to be experiencing a fourth wave here this fall, we're going to have a fifth wave in the spring and a sixth wave next fall and a seventh wave the following spring. And it's going to take multiple generations of infections and thousands of lives in Acadiana ruined and lost and affected to get to that point. And achieving herd immunity through having everybody get infected is not a practical, realistic, or humane way of looking at this pandemic.
Let's talk a little bit about the side effects of what happens with COVID. I have a relative who she did get half of her sense of taste back, if you will, but she still has a little bit of that's gone. Other people have very different experiences. Someone else in my family shared with me a young person that is their friend. They're still, it's been 4 or 5 months and they're still dealing with issues in their lungs. So when you get COVID, some people get a lot of leftover stuff. What kind of stuff? And I guess it can last for a significant amount of time. It seems like it varies so much, Doc.
Yeah, no, this virus is having, very long-lasting effects on a lot of people. Mm-hmm. And as time moves on, we're learning more and more about that. The loss of sense and taste and smell is a big problem. The problem with it from a healthcare standpoint is when you lose those top notes in your taste and your smell, you tend to gravitate toward less healthy foods,
yep.
So fattier foods, salty foods, sugary foods. And we see that in the elderly population a lot because, as you get older, you do tend to lose your senses, your hearing, your sight, your taste, your smell, and they tend to gravitate toward more unhealthier foods. Also, in a more compelling way, is when people get a significant pneumonitis, significant inflammation in their lungs, they get scarring in their lungs. And our lungs are these wonderful, elastic, soft, spongy things that, it's like the ultimate memory foam. And when you get COVID, it's like that memory foam's been sitting in, let's just say, a hot car or hot attic for an entire summer, and that plastic starts to degrade and it gets stiff, and when you squeeze it, there's just no elasticity there anymore, and it starts crumbling, and it's fibrous. That's exactly what happens in people's lungs. They get protein deposits, they get inflammation, they get fibrosis, and our lungs are one of the weak parts in the human system. They really are. You can live without a lung, but you can't live well without one of your lungs. And, one of the major causes of death in the entire population is pneumonia. And as we lose breathing capacity and as our pulmonary function capacity gets diminished through infections like COVID, then we tend to be more susceptible to those things. We're going to see, unfortunately, I think as time goes on, we're going to see the age at which people ultimately leave this world and die get lowered. And we've seen that already in the United States over the last year, in that the average age of death is starting to decrease, and I'm afraid that we're going to start seeing that. And that's a direct reflection of this pandemic and how it's affecting people long term.
And I'm curious, ivermectin, that's something that people have asked me about. What is that? Is that something that helps? I'm not sure what it is. So
ivermectin, yeah, it's an antiparasitic drug.
Okay.
That has it's not FDA approved for treatment in humans. It is used in some third world areas for treatment of certain parasitic infections.
Okay.
But it's been purported to have significant effects for a wide variety of diseases.
Okay.
From cancer to pneumonia to COVID. Unfortunately, we have not seen large, well-produced studies that have shown a significant benefit to the use of ivermectin.
Okay.
Even though it's currently a genetic drug, and nobody, quote, makes any money off of it, anything that can show efficacy is going to be pushed to the forefront and highly encouraged in its use and studying it. there's no question that because there's been such a fringe element or push about ivermectin on the internet over the last, since the internet's been here basically, that there's definitely a bias in the scientific community against it. But I think that there's enough scientists out there that aren't biased that if we thought it had, if people who really understand the disease, really understand the pharmacology, and really understand the way these studies work, felt like it was going to be something valuable and worthwhile,
that they would have jumped on it,
that
right?
it would be advanced.
Right.
Exactly.
Yeah.
Exactly.
Yeah. Look, there's still a lot of people out there, and I get it because, I had to go through the process for myself to decide what I wanted to do in terms of, am I going to get the vaccine, et cetera, et cetera. For those people who are still on the fence, and look, there's a lot of people, and it is their body. People can do what they want to do. Is the herd immunity kind of the number one thing, and their own health? Are those the top two things that you would tell people to suggest, hey, go ahead and do this? People are so fearful of the side effects, which I get. I mean, we all have our own health issues, but kind of what are your top few things that people, you would want them to think about to get the vaccine?
Well, the biggest problem, Bernie, is that there's so much information out there, and nobody knows who to trust or what to trust.
Yep.
Okay. So the other problem is that there's a psychological phenomenon where once you're given a piece of information, whether that information is wrong or right, once you kind of lock that piece of information in your head, it's really hard to wedge it out. So that if you're presented with some data and some information that's wrong, but you don't know it and it seems reasonable, and you then adopt that as the way you think about something or look at something, if you're presented with data later on, it's very difficult to wedge out that old information and cram in the new. And that's the old dog, new tricks phenomenon that we're talking about. In medicine, we have to do that. We're taught one way. You have to do it this way. If you don't do it this way, people are going to die. People are going to suffer. And then we have to pivot. So, early in the pandemic, it was all about early intubation because we know that putting people on ventilators with bacterial pneumonia saves lives. And so we said, okay, this is pneumonia. We're going to treat it like, we do all of our other patients right now. Well, that was wrong, and we all had to really reconsider and change the way we think about this disease and pivot 180 degrees and start doing things differently. It's the same way with the information about the vaccine. So what I would tell you is look for good sources of well-informed information. Immunology is incredibly, incredibly complicated. Way back when I was in college at LSU, my emphasis in my microbiology and biochemistry degree was in immunology. And the reason I chose that was because that was one of the areas in medicine that was the least was known about. More and more information was coming out. The transplant immunology was absolutely fascinating at the time, and I knew I wanted to go into surgery, and that was one thing I was potentially thinking about. And immunology, in fact, impacts everything, about the human system. It's where we interact with the world on a cellular level. We're constantly exposed to viruses and bacteria. The science behind this vaccine has been well established for years. The science of vaccination has been well established. It's a novel way that we made this vaccine, but even way back then at LSU when I'm sitting in my 400-level immunology classes, they're talking about one day we're going to be able to take an mRNA fragment, program the fragment, and instead of injecting people with viruses, weakened viruses, which is what a lot of our immunizations are, we're just going to inject them with a little bit of code that's very temporary and transient in the system that's going to make their body make a protein to which they're going to have an immune reaction. It is the ultimate vaccine. It is the most elegant solution that we've ever come up with giving people immunity without having to have an infection. A recent AMA study polled a bunch of physicians across the United States, and it was fairly well distributed in regards to their political affiliation. About a third were left-leaning, about a third were right-leaning, and about a third were independent. There was a 96% complete vaccination rate amongst the physicians who were polled and paneled. So the people in our community who are in the position to know best whether it's safe and to make a personal decision about their own safety and health have all chosen to become vaccinated. And so if you're looking to see what you should do, you look at the experts and see what they did for themselves, right? You want to make money, you look and see what the guys making money are doing, and you repeat that and you imitate that. You want to be healthy, you look at the healthy people and see what they're doing, you imitate that. If you want to avoid getting a COVID infection and you're worried about the vaccine, look at the healthcare professionals who are in the best place to understand about the vaccine and who have the pre-existing knowledge and have studied these things for decades, and look and see what they're doing. And what they're doing is they're all getting vaccinated. And so I think there's probably not a more compelling overall health issue for a healthy individual in Acadiana right now than vaccination. I think that ought to be your number one health priority.
And, you talked about getting information from good sources, and that's why we constantly ask you to be on our show. We are speaking with the Chief Medical Officer of Our Lady of Lourdes, Dr. Henry Kaufman, talking about the Delta variant, COVID, what we need to do, what people are looking at, vaccine, politics, all of it in between. Ian, I know you had some more thoughts.
And Dr. Kaufman, I spoke with someone the other day who related this anecdote to me. He said that he knew of people who had gone to doctors' offices in Lafayette, did not say what doctors or with whom those doctors were affiliated, and that some of these doctors were going in, squirting the vaccine into the bio trash can, and then filling out the forms as if these people had actually received the vaccine so they could have a card so they could travel or do whatever they needed to do with the vaccination card. Have you heard any stories of this? And what are your thoughts, or does this scare you that this may be something going on in our community, if it is indeed happening?
Well, there's lots of crazy stories running around. There always are. We certainly know that there was at least one incident where a pharmacist left a bunch of vaccines out overnight intentionally in order to defunctionalize them and make them unusable, and a bunch of people were vaccinated with that. Fortunately, we picked that up. That individual is currently serving a jail term, and I think most physicians value their license and their career and their standing community enough to not go there. And not that, physicians aren't culpable of the same traits that the rest of humanity is, and, as far as the 7 deadly sins. But I would tell you that I think that those stories, for the most part, are urban myth and legend, because it's
it's easy to tell a story, right?
There's no question that vaccination cards could be faked, but no one's requiring vaccination cards right now except in very limited circumstances and certain employers. Now, I will tell you that I think it's going to be, as more and more people get vaccinated, I strongly suspect that there will be more and more employers in the region and nationally that will require vaccination of their employees. And so I think we all need to prepare for, psychologically for that to happen. If you're strongly opposed to the vaccine and you're working in an industry where there's a high likelihood, because of a lot of people in close association, let's just say, oil field workers offshore, for example, I think you need to start thinking differently about getting the vaccine, because it may be a requirement of your employer moving forward.
Dr. Henry Kaufman, who is the Chief Medical Officer of Our Lady of Lourdes. Sir, we're coming to our time now, and I want to thank you so much for spending time with Ian and I. As always, we appreciate your insight into everything, and hope that people will continue to wash their hands, use hand sanitizer, and as you said, for some possibility of some employers, going forward, maybe mandating that. That is something to certainly consider and kind of get straight in their minds. Dr. Kaufman, thank you very much for your time this morning, sir.
You're very welcome, Bernie. Hope you have a good day. Stay safe, stay healthy.
We will,
you too.
sir.
Thank you
too. It's coming up now on 7:29 on Acadiana's Morning News. Dr. Henry Kaufman, again, the chief medical officer of Our Lady of Lourdes. And so the Delta variant, as he was saying, this time, unfortunately, with this, when they mutate, right? Viruses do that all the time. This Delta variant is, just more powerful, unfortunately. 30% of Louisianians are vaccinated. Again, I understand people got to do what they think is right for themselves, and their body. I did mine because I have this laundry list of fun stuff. I have 2 other sisters. Had 3 at one point, but I got the booby prize in the family. Like, they have they might have a little problem here, a little bit of this. I got all the yucky stuff.
Yeah.
I'm like, thanks, parents. Thank y'all so much. So again, we give you the information. You do with it what you choose.
And if there's one bit of information from that you take away, is that Dr. Kaufman said we can achieve herd immunity one of 2 ways: through the vaccination or by going through a 5th, 6th, 7th, 8th wave over the next few seasons.
Yeah, that part kind of sounds really stinky to me. That sounds just annoying, kind of frustrating, that part, for sure. It is coming up now on 7:31. Time now for weather. It's another thing we got to think about today.
Yep.
Backflow has already started for the river, meaning that we sure don't need any more rain today, but 80% of us are going to experience some showers, maybe some showers into this evening as well. But Daniel Phillips is the expert, so we'll see what he has to say about today.